A study in Bristol has found almost three-quarters of patients were still suffering with coronavirus 3 months after being admitted to hospital. Respondents said they were struggling to carry out daily tasks like washing, dressing, or even going back to work. Well, joining us now is Dr. David Arnold, who's researcher at North Bristol NHS Trust. Thank you very much indeed for joining us this morning. So some patients just can't seem to shake off these symptoms. Why is that?
Well, I think that's a really difficult question to answer. We've really just identified the problem at the moment that three-quarters of these people are still having ongoing symptoms of breathlessness, muscle aches, and excessive fatigue. Perhaps it's something to do with some low-grade inflammation going on in the body, some damage that the coronavirus has done to their organs that we can't detect. And the not to be underestimated toll of recovering from a severe infection and then hearing about that infection many times on social media and the news daily afterwards.
Now, you mentioned damage to organs. Are there any evidence of lung scarring at all?
Well, actually, reassuringly from our study, there was a significant number of people's lungs had improved, but they're still reporting symptoms of breathlessness. So I think the advice for GPs and for patients is that even though a lot of people will report ongoing symptoms, we may not be able to detect exactly why at the moment, and we need to do ongoing research to work out why that is.
And do we have any figure at all as to how many people are struggling like this?
Well, in our study, which is preliminary results from a hospital study at a single site here in North Bristol NHS Trust, three-quarters of our patients had ongoing symptoms 3 months after discharge from hospital. Now, if you consider that 130,000, well, over 130,000 people were hospitalised with coronavirus in the UK alone, that gives you an idea of the scale of the problem, and then add in the many, many more community cases.
And also, is it affecting more men than women? Is there a sort of gender discrimination here?
In terms of the ongoing symptoms, actually the symptomatology was really fairly equal between the groups. Coronavirus does tend to affect men more, and we've not really drilled down as to exactly why that is.
So you did mention about, we mentioned earlier actually about some of the tasks that they're still struggling with, such as dressing, going to work, washing. What other problems are they having months after this? Does this include loss of smell and taste as well?
Great question. So in terms of the symptoms that we saw that had actually improved, those were things like fever, as you'd expect, and also that loss of sense of smell, anosmia, actually was improving. But other problems that we didn't expect to find so late on were things like people still struggling to sleep, a significant proportion of them, which is obviously affecting their ability to go back to work. We had a lot of very young, fit people in this study and a lot of healthcare workers who are still struggling.
And, once people have gone through coronavirus, which is obviously, as we know, just absolutely horrific, conditions to have. And as we know, the death toll, well over 41,000 here in the UK. And once people have recovered, how do they then know that this is just, just sort of a normal part of, the recovery process? And how then can they know that actually there is a problem here, you're still suffering from COVID-19?
Well, I suppose we shouldn't be surprised by these findings. This is exactly what patients have been telling us, that they are struggling many, many months down the line. This is the first study of what I imagine will be many showing that patients are having ongoing symptoms, and we need to work out why. And one of our big pushes now will be to look at research, trying to investigate these findings. We've teamed up with researchers at Bristol University's Uncover COVID group to look at complex inflammatory pathways and immune response in these patients to try and work out why they're still having ongoing symptoms this many months down the line.
Dr. David Arnold from North Bristol NHS Trust, thank you very much for your time this morning.